Hey guys, this is your pharmacist Sidra and welcome to Pharmacy Tech Study Guide. In this video, I'm going to discuss 11 routes of medication administration that you must know while working as a pharmacy technician. See, as a pharmacy technician, you will be working closely with the pharmacist and you will be dispensing not only tablets and capsules, but you will be dispensing suppositories, vaginal tablets, inhalation medications, and many more. So for the safety of the patient, you must know all the routes of administration. For example, a common perception is that tablets are always taken by mouth. But my friends, there are tablets which are actually inserted rectally or vaginally. So if you don't know that those routes of administration also exist, you won't be able to dispense the right medication for the right disease state, right age, and the right reason. Now, you may wonder, why do we have so many different routes of administration? Why can't we just stick with the oral or injectable route? Well, it's because the way in which the body absorbs and distributes the medication varies with the route with which it's given. See, if the patient has asthma, it's beneficial to use the inhalation route of administration, which would actually give the medication directly into the lungs and give more localized effect in comparison to given an oral like a tablet or capsule, which has to go through the digestive tract and then absorb in the bloodstream and then get to the site of action, which is not very smart in this case, right? Similarly, let's say if someone is nauseated and they're just throwing up anything that take by mouth. So giving an oral medication is not really beneficial in this case. In this case, maybe we should consider giving a suppository, which would help relieve the nausea. And also, we're not getting into that problem of patient throwing up every time they take something by mouth. You get the idea now, right? Well, another reason why you need to know all these routes of administration is remember that the patient depend on us to give the right medication via the right route. So for us, it's always important to put the patient safety first, and actually it's important for you as a pharmacy technician to understand that route of administration, because if you don't understand that a tablet may be given vaginally or rectally as well, how can you actually fit in those directions right and then ensure that the patient is getting the medication right way? Basically, the bottom line is we always put patient safety first. If the directions on the prescription are not clear, which sometimes they're not clear, you never assume. This is something that we don't do in pharmacy. We don't make guesses. If you are in doubt, always check with your pharmacist and get the clear direction. All right, now that you know the importance of knowing the routes of administration, let's make sure you have good understanding of each of these routes. So first of all, let's talk about the most common route, which is the oral route. The medical abbreviation for this route is PO. Majority of the drugs are administered orally as it's the most convenient, safe, and affordable route of administration. In this route, the effects of the drug in the body is dependent on its absorption in the digestive system. Because when you take the medication orally, it passes the esophagus and then gets into the digestive tract. It gets absorbed there, gets broken down there, and then it goes into the bloodstream. So the absorption basically begins in mouth, continues in the stomach, and then is completed in the small intestine. Now, in order for the drug to reach the bloodstream, the drug need to pass through the intestinal wall and liver, which can chemically alter the medication, and as a result, the amount of drug absorbed in the body is lower than the amount of drug which is administered initially. Also remember that when a drug is taken orally, its absorption is also affected by food and other oral medications that are in the digestive tract. Now, without getting into much detail, I want to talk about a simple overview of what happens when you take the medication by oral route. So it goes from mouth to the stomach, then small intestine. Now, different enzymes in the stomach and a small intestine breaks the drug, and from there it gets into the liver, and from liver it goes into the bloodstream, where it attaches to different receptors and proteins in our blood, which actually carries the drug from bloodstream to the site of action. Now, in general, we commonly stick with the oral route of administration, but alternate routes may be needed when, let's say, the patient is not able to take anything by mouth, or rapid or more localized action of the medication is needed, or the drug is not stable or is poorly absorbed via digestive tract. In that case, we go for other routes of administration like injectables. Now, when we need a rapid action of drug, or when we don't want a medication to be destroyed by all those digestive enzymes, then we use injections. And this is called parenteral route. There are so many parenteral or injectable routes, but there are some common ones that you must remember. For example, the intramuscular, subcutaneous, intradermal, intravenous. Let's first talk about the intravenous route, which is a very common route. In medical terminology, venous refers to veins and intra means inside. So intravenous means medication is administered directly into the veins. Makes sense, right? Now, normally when we need large volumes of medication administered at a slow or continuous rate, that's when we use the intravenous route. For example, dextrose solution or a normal saline solution, very common ones, these are given via intravenous route. Then we have the intramuscular route. Here as well, intra means inside and muscular refers to muscle, which implies that the medication is administered into the muscle. Now, generally speaking, medication given through this route has slower onset of action compared to the intravenous route, but the duration of action is actually longer. A lot of vaccines are administered through this route, and about 1 to 1.5 inch needle is used for this injection, and the injection is administered at a 90-degree angle straight into the muscle. In pharmacy, we commonly use the deltoid muscle or the upper muscle of the arm, but in hospitals or other settings, intramuscular injection can be given in thigh muscles or in the buttock, but that's not a common practice in pharmacy. All right, so the next injectable route I want to talk about is the subcutaneous route. In this route, the medication is administered under the skin into the subcutaneous tissue of the skin. And this route generally provides slower absorption compared to the intramuscular administration, but the absorption is faster compared to the oral route. Now, some of the common drugs in pharmacy that are given via subcutaneous route are insulin, a very, very common one. Pretty much all the insulins are given subcutaneously. Also, blood thinners like enoxaparin. Also, some of the vaccines are given through SQ route, like the MMR vaccine or chickenpox vaccines. But in general, for sub-Q injection, you will need a smaller length needle compared to IM injection, and the needle is injected at an angle like a 45-degree angle, and the area that you commonly use is the outer area of the upper arm, front or outer thighs, or you can also do it in the abdomen, normally 2 inches away from the abdomen, and in that case we just use a very small needle at a 90-degree, 2 inches away from the navel. All right, lastly, in the injection category, I want to talk about the intradermal route. Intradermal injections are administered into the top layer of the skin at a slight angle using a shorter needle compared to the sub-Q needle. Now, this is the least common route of administration in pharmacy. Mostly drugs that are administered via intradermal route would be diagnostic drugs or some of the immunizations that we normally don't do in pharmacy. All right, next up, I want to talk about the sublingual or buccal route of administration. In sublingual route of administration, the drug is placed under the tongue, which is sublingual. And in buccal route of administration, the drug is placed between gums and teeth, which is the buccal cavity of the mouth. Basically, the drug dissolves in those areas and it enters the bloodstream directly through the small blood vessels beneath your tongue or in the buccal cavity. Now, these drugs must not be swallowed, and they actually require special formulation that enables it to disintegrate in the mouth. Sublingual tablets are actually highly water soluble, so the patients must take like a sip of water or wet their mouth if it's dry. And the patient must be advised to take no food or beverage until the medication is fully absorbed, because you want to make sure the contents of the medication are absorbed in the mouth and they're not swallowed into the digestive tract when taken with another beverage or food. In the rectal administration, the drug is administered into the rectum, of course, as a suppository or liquid form. The medication is formulated in a waxy substance that actually dissolves or liquefies after it's inserted into the rectum, and it's shaped in a way that it's easy to insert it in the rectum. And after it's inserted into the rectum, it's easily absorbed into the bloodstream through a rich blood supply, which is, present in the rectal wall. And here's the thing to remember, that most of the drugs that can be taken orally can also be administered rectally as a suppository. The drugs are administered into the rectum to either get a more localized effect, or maybe the drug kind of degrades after oral administration. So, we use the rectum route. Just keep in mind that the medications used via rectal route come in suppository, and mostly suppositories are wrapped into individual like blister packs, just so the weather or the atmosphere doesn't destroy them prematurely. And it's very important to make a note on the prescription saying that unwrap and insert the suppository into the rectum, because if you don't say that, trust me, it's not even a joke. I've seen so many patients come to the pharmacy and say, oh, inserting a suppository hurts, because they actually did not unwrap the suppository and try to insert the suppository with the wrapper. So it's very, very important that you as a pharmacy technician understand that the patient is super naive. They don't know anything about the medication. You have to give them each and every instruction from A to Z. Now, a lot of drugs can be administered vaginally as well, and these drugs are in a solution, tablet, maybe gel or a cream form. A lot of times these are maybe just like a ring form, which the ring can be inserted in vagina. The medication is again, absorbed through the vaginal wall and is used to provide more localized effect. A lot of times that could be, maybe somebody has vaginal dryness or has some menopause symptoms. This, estrogen gel or estrogen rings can be inserted through the vaginal route. A disadvantage of vaginal route is that the medication may be expelled also. There is a possible risk of toxic shock syndrome, which is TSS. This is a very rare but potentially fatal disease that results from severe bacterial infection of the blood. Now, it is caused when the medication is given, of course, via vaginal route. Now, what happens is that when a medication is given via vaginal route, possibly that medication pushes the bacteria, which are natural to vagina, into the bloodstream. And this could result in high fever, muscle ache, or dizziness. And this is very kind of, inconvenient. And if this happens, it can be actually treated with the antibiotics. But, something to keep in mind if someone is using a medication via vaginal route. All right, next, let's talk about the ocular route. In medical terminology, ocular refers to eyes. In this route of administration, the drug is applied into the eyes as a liquid, gel, or ointment form. Now, liquid eye drops may have lower absorption, as a drug may, run off the eyes quickly. However, the gel or ointment form may have better absorption due to longer contact time with the eye surface. But here's something to remember. The eye drops or eye ointments can cause blur vision, and it only produces localized effect in the eyes, and there is minimum systemic absorption of the medication. Now, if the patient is using eye drops and eye ointment both at the same time, then it's important we let the patient know that both of these must be separated about 5 minutes, and eye drops must be administered before the eye ointment, because if done the other way, then the ointment, because it has more of an oily nature, may kind of form a barrier in the eyes and will not let the eye drops absorb. Also, if a patient is administering multiple eye drops, then again, they must be separated about 5 minutes from each other. And here's an important thing to remember. A lot of people, when they instill the eye drops, they just instill it in the white portion of the eye, or just straight into the eyeball, which is not the right way of doing it. The eye drops are always instilled in the eye sac, the red portion of the eye, and preferably in the corner of the eye. So you push the eye down and then instill the drops in the red portion of the eye, and then you close the eye and kind of block the inner tear duct of the eyes, just to kind of prevent a lot of the eye drops to fall out of the eye. although in this case still it is expected for excess eye drops to kind of, wash out of the eye, but nothing to be alarmed because the amount of medication that is needed as a single dose did actually get into the eye. All right, moving on. Next, I want to talk about the otic route. The drug administered to the otic route basically goes into the outer ear canal as liquid drops. Pretty self-explanatory. If you have actually watched my video of terminologies, which I'm going to put link up here, you will know that in the pharmacy terms, otic means ear. So otic route meaning the medication is actually going into the ear. Now this route is used to treat local ear infections or any inflammation in the ear, and there is minimum to no systemic absorption. Next we have the nasal route. So the adult nasal cavity, you'll be surprised that it has a capacity of about 20 mL, and it is actually rich in blood supply. It's a large surface area for the medication absorption. So the intranasal absorption of some drugs really produce blood concentration similar to intravenous administration. And commonly solutions, suspensions, ointments, gels, sprays, they can all be administered via intranasal route. Basically, any drug that is sufficiently volatile can be administered via the nasal route. And commonly, nasal decongestants are, used via this route. They're in the spray form. And a very common example of a nasal medication would be like a Flonase that you can get over the counter to help with the nasal decongestion. Now, the way you administer the nasal sprays is that you simply blow your nose and you gently basically clear both the nostrils. And of course, you want to wash your hands afterwards. And then with your head upright, close one nostril with one finger, close your mouth, and then insert the tip of the spray into the open nostril. And then you're gonna breathe in through the nostril, not through the mouth. Breathe in through the nostril, hold the breath for a couple of seconds, and then breathe out through the mouth. Now here's the tip. You are going to inhale in through your nose, breathe out through your mouth. All right, next up is the inhalation route. This route is basically used to deliver medication directly into the lungs. The drug is inhaled through the mouth, it passes the tracheas, and it goes into the lungs. And the size of the inhalation droplets basically determine how deep your medication is going to penetrate into the lungs. Smaller the size, deeper it's going to go into the lungs, and higher the absorption will be. So smaller size, deeper it's going to go in the lungs, and higher absorption rate it's going to have. So lungs basically are these big balloons in our chest, and they have large surface area of absorption because they have these tiny blood vessels which are rich in blood and oxygen. This route basically avoids the problem of degradation and poor absorption of drugs that occur via the oral route. So a lot of medications which are used to treat asthma or bronchitis are ideally administered through the inhalers. But here's one thing to remember, that there is enough inconsistency in the absorption of the drugs from lungs because often the patients do not use the right technique of the inhaler and do not use the right inhaler. So always make sure that you refer the patient to the pharmacist so the pharmacist can educate the patient about the right and proper use of the inhalers. The topical route is used to apply a drug directly onto the skin and get a more localized effect. The drug is absorbed from the skin into the bloodstream, but the systemic absorption is minimum. Normally, ointments, creams, lotions, and powders are used via topical route to treat any superficial skin condition, like if you have dry skin, you have eczema, or even the pain. Then we have transdermal route. In transdermal route, the drug is administered by applying a patch onto the skin. Now, the only difference between the transdermal and topical route is that when you apply a medication through the topical route, it goes deeper into the skin. The transdermal route, the medication goes just onto the dermal layer of the skin. Now, here's the thing. The patch basically delivers the drug slowly and continuously for many hours and even up to days. And this actually results in more constant levels of the drug throughout the days. Now, only drugs that require small daily doses should be administered using a patch or a transdermal route. Some of the examples could be like a fentanyl patch for pain relief, that's your control 2 medication. Also, some of the nicotine patches, or you can say your lidocaine patch, which is used to treat pain as well. Now, a lot of times when you apply patches onto the skin, they stay there for a couple of hours. They can cause skin irritation. Normally, I just tell the patients to use Benadryl or a cortisone cream to help with that itching. But patients must also be rotating the site of application, because you don't want the medication absorbing into the body from the same site. So the patient must always be rotating the site of application. And another important thing to remember is often when a patch is applied, the heat may affect the absorption of the patch. There are some patches like fentanyl patch which must not be cut, because if you cut that patch, the medication may be dumped kind of super fast in the body. Also, the medication may get onto like a person's hand, which is not safe. Also, the medication may get like onto the bare skin, which may result in like toxicity. Alright, so this is it for today's lecture. I hope now you get an idea of some of the common routes of administration that you may come across as a pharmacy technician. There are so many different medication formulations which are actually made keeping the routes of administration in mind. So it's important that you also understand all these different medication formulations, which I have a separate video on. Make sure after you are done watching this video, you go on to that video and understand those different medication formulations, because both of these lectures are kind of connected. And if you have any questions or topic suggestions, don't forget to leave it in the comment section, and join me in the next video in which I'm going to talk about different dosage forms of the medications.